To administer cervical traction, the traction control unit needs to be inserted at the head end of the table. Remove the pillow and make sure your poundage is turned to the lowest setting. The cervical traction device fits into the bracket on the table top. Switch the table to the cervical position and insert the short T-buckle into the traction control unit. With the insert pad facing the ceiling, position the patient's occipital region into the upper inside ridge of the cradle support. Tighten the tension knob until the patient feels a slight inward pressure. Secure the forehead strap and pull the web strap firmly through the T-buckle assembly. Set the timer to 7 to 10 minutes. Adjust the upper set of rollers to relax the thoracic area during traction. Adjusting the variable speed to 7 or 8 seconds of pull and release is recommended for patient comfort. As the table comes back to the relaxed position, slowly increase the poundage. Usually 10 to 30 pounds should be sufficient. You can palpate the cervical area and feel a slight separation. When treatment has ended, the table will stop in the cervical position. Release the tension from the T-buckle and loosen the tension knobs on the cradle support. Assist the patient to a seated position. To use the head halter cervical device, insert the T-buckle into the traction control unit. Usually the T-buckle should be lifted to its highest position since this angle will direct more pressure into the occipital area. Clip the head halter to the bowspring with the clip facing out, then hook the bowspring up through the eye bolt. Place the pillow about 5 inches from the top of the table. The top of the patient's head should be at the top of the pillow. Cover one of the white pads with a tissue and insert it into the chin pad. Have the patient hold the chin pad so that the seam bisects the chin. The Velcro strap helps contour the chin pad to the patient's face. Grasp the straps on either side of the small occipital pad and slide it onto the patient's head. Hook these straps to the sides of the chin pad and tighten both sides equally. Standing at the head of the table, push the traction control unit forward and tighten the occipital straps on either side of the patient's head. This is important because only now will most of the pressure be transferred to the occipital region. Set the timer and raise the upper set of rollers to help relax the upper thoracic region of the patient. Patients new to cervical traction may be tense, so 10 to 15 pounds is usually sufficient for a first treatment. Palpate the cervical region as you dial the poundage. If greater pull or longer treatment time is indicated, it's advisable to increase these over several treatments. For constant traction, turn the table switch off during the pull cycle. Under constant traction, the patient has a full range of motion. So rotation is possible and manipulations can also be performed. After treatment, move the switch to the cervical or rest position. To remove the head halter, lift and twist the clip, then remove the chin pad. Lengthen all but the bowspring straps and remove the harness. Allow the patient to rest a few minutes before rising. For passive shoulder exercise, after testing the patient's range of motion, attach the ankle strap to the wrist. Then, with the table switched to cervical, thread it through the T-buckle. To keep the traction unit from moving, set the poundage to 20 to 30 pounds. Now, turn on the timer and slowly increase the patient's range of motion by drawing the strap further through the traction unit. The patient's other hand can assist as the treated arm returns. Over a 10-minute period, the patient will experience about 80 uniform movements. Passive exercise may also be applied around the bicep to abduct the arm. Traction to the elbow or shoulder can also be applied by transferring the traction unit to the foot end and pulling down on the arm. For arm, shoulder, or upper dorsal traction, attach the gripper bar by threading the web strap through the T-buckle. Set the timer to start the table and adjust the bottom set of rollers. Dial a comfortable poundage level for the patient, usually 1/4 to 1/3 of the body weight. Position the patient so that the sacrum is below the table opening and the arms holding the gripper bar are fully extended. Since the patient is lower on the table, these rollers will now treat the upper thoracic area. To treat scoliosis, use about half of the poundage needed for bilateral traction. Then slide the gripper bar to the side of the patient's concavity. This applies unilateral dorsal traction to that side. Because the patient will tend to inhale during the pull cycle and exhale during the rest cycle, additional benefits in lymphatic flow and enhanced respiratory function are often achieved.